the public regarding the novel coronavirus that has recently been identified in a Washington State resident. I'll give you some just basic information about the situation, and we have a host of scientific and medical personnel that will talk about our multi-tiered response to this particular concern. Just specific dates from November to January 15th, we had a Washington State resident, a man in his 30s, who was in Wuhan, China. On January 15th, he returned through SeaTac to his residence here in Washington State. He fell ill on January 16th and went to be evaluated for his condition on January 19th at his local clinician. At that time, it was suggested to him that he remain in isolation at home so he would not be a particular potentially transmitter of any particular disease. He was then, on January 20th, samples were confirmed by the CDC in Atlanta that, in fact, he carried the novel coronavirus, and he was hospitalized, and we're very happy to say that he is in satisfactory condition, and as of this moment is being is very helpful in us identifying particular people that he may have been in contact with. We think this has been a very rapid response. We want to express our appreciation for the CDC, for King County Health and our state health department. We think that they have demonstrated a really good working relationship in having a multi-tiered, multi-level response to this particular concern. And so far it has been extremely quick, from a Sunday designation of illness and next day have it identified. We're pleased for the ability of the scientists to be able to identify this particular disease. General, if I can just say at this moment, as Governor of the State of Washington, the good news is the CDC, and we also agree that the risk is low to residents of the state of Washington. And this is certainly not a moment for panic or high anxiety. It is a moment for vigilance, and we are pleased to report that we have a very comprehensive approach that is acting very quickly to respond to this, to identify the potential folks who may be subject to transmission, and also obviously care for the individual who's involved to date. If I can just talk about this for a moment. The good news is our local and state health departments have been prepared for this for some time. They have drilled on a response in this regard. And the local Snohomish County, health department has been working closely both with our State Department of Health and the National CDC in a response to this challenge. The approach that is now being taken, we have been in close contact with CDC to try to prevent additional folks from coming who otherwise would not know about their infection capability from China. So what is happening is that the teams have employed a multi-leveled approach in that regard. We're pleased that the CDC has adopted a policy of essentially having only 5 airports in the United States who will receive visitors on direct flights from China or in linked flights from China. And those folks will be subject to a screening protocol that the CDC will be responsible for. So at SeaTac, there will not be folks visiting from China who will fly directly or even on a connecting flight that do not go through those 5 airports. So the people who fly into the state of Washington in the immediate future will be needing to go through the 5 airports where they have some additional screening that the CDC will be responsible for. And we're confident in their abilities to work in that regard. As far as what Washingtonians should do or not do, I'm going to let John Weisman talk this about detail, but I think the important thing to know is that there isn't a risk level that would suggest people should be doing anything differently than they normally would. Like I said, this is not a moment of high anxiety. We should all do exactly what we always do, which is, this is flu season, so we wash our hands, we cover our mouths when we sneeze, and when we are ill, we stay home from work so we don't expose other people to infection. We just think people should continue that. We do not believe this is something that should interfere with people's daily lives or even a position of anxiety in this regard. However, we take this very seriously. As we have in previous infection cases, where the protocols that we have adopted have been largely successful, and I'm pleased to see them acting very quickly today in that regard. And we will continue in that vein. So with that, I want to turn over to John Weisman, who is one of the players, and I should reiterate this. This is a team of multi-jurisdictions. I'm glad to see it operating, and we'll turn this over to John.
Okay. Novel coronavirus. I first want to start by recognizing the quick, collaborative work being done with our local and federal public health and healthcare partners. Over the holiday weekend, this group of people quickly identified a possible risk, coordinated the patient's care, sent samples to the Centers for Disease Control and Prevention in Atlanta, and CDC tested them immediately. Now, together, we are implementing actions to ensure the public's health is protected. I'm thankful that the man who tested positive for this virus acted so quickly and sought treatment. His actions gave us a head start, and because of that, we were able to isolate him away from the public. As the governor said, all of this basically means our work, that this risk is low to the general public. Our first priority on Sunday when the patient sought treatment was to make sure that the patient got appropriate care and that samples were collected and sent to the CDC to determine if he was a case. During that time, we made sure that the patient was isolated from others. We activated our incident management team last night. Our number one priority is to complete the identification of all the patient's contacts, reach out to the contacts, and monitor their health. We also want to make sure that we are communicating information about the situation with the media and the public. Late this morning, 3 of our colleagues from the Centers for Disease Control and Prevention arrived to provide technical assistance and continue our close collaboration with the CDC experts in Atlanta and around the world. This is an excellent example of the collaboration and how the public health system needs to work together for the biosecurity of this country. I just want to reiterate what the governor said, which is at this point, folks should go around and do their normal business. And as he said, if you have a cough or sneezes, cover those. Stay home if you're ill. If you have not yet gotten your flu shot, do that. In part, that's just good health this time of the year. But if somebody should have this infection, it helps us rule out other diseases of concern. So with that, I'm going to turn it over to Dr. Scott Lindquist, who is our infectious disease epidemiologist, to give us some more information, and that will follow with other folks from the local health department and Providence and the Centers for Disease Control. Scott.
Is to make sure every county is available and ready to evaluate patients that travel. So I know we talk a lot about airport screening, but that is only one piece of the system to really detect and take care of patients. So we have talked to every local health jurisdiction in the state. We've sent them guidance based on the experience at Snohomish on how to isolate, test, and what's the appropriate action for these patients. So I'm feeling good about this because we have had experience with other viruses that have primed the system, and we have the infrastructure there to do this. So that is something that's already in place as we speak right now. Now, having said that, there had to be the first case somewhere. And sorry, Dr. Spitters, it was in Snohomish. But I gotta say, this couldn't have gone smoother. And I think Dr. Spitters can give us some experience, because there's a lot of details in this. This gentleman travels, who and how do you investigate who he was around? How do you even get him from his house to the hospital? What kind of conversation was the hospital, and what did you think when you got the phone call? I think those are all important things that we're working through for the rest of the country. So, Dr. Spitters, you want to give some detail on
the Snohomish Health District? And just to give you, from the local perspective, our involvement in this, once we learned about the case and worked with the state health department and CDC last night, the Snohomish Health District coordinated with the Snohomish County Emergency Medical System to safely transport the affected patient to Providence Regional Medical Center in Everett, where he was admitted to the hospital. And following our jointly developed infectious disease protocols, we requested that Providence aid in isolating and monitoring the patient, which they've been most gracious and generous in doing. As stated earlier, our perception is that the risk to the general public in Snohomish County and beyond is low with respect to this particular exposure. We're working with Providence Medical Center to ensure that the small number of healthcare workers and patients who may have been exposed are identified and monitored for follow-up. As Scott, you said, nobody wants to be the first in the nation with these types of problems, but these are the types of situations that public health and its partners train and prepare for, and because of this collaboration, everything has been going quite smoothly. So on that note, on behalf of the Snohomish Health District, I'd like to thank CDC, the Washington State Department of Health, Providence Regional Medical Center, and all of our partners locally in Snohomish County who have been helping us in responding to this situation. And with that, I'd like to turn it over to Dr. Cook from Providence Regional Medical Center.
Good everybody. I'm Jay Cook. I'm the Chief Medical Officer of Providence Regional Medical Center in Everett. Just a few remarks. Most has been covered by more eloquent speakers than I, but we at Providence Everett Medical Center are working closely with our colleagues at the CDC and the Washington Department of Health, as well as the Snohomish Health District, to care for a patient who tested positive over the weekend for the novel coronavirus. The patient is currently in satisfactory condition because the risk of human-to-human transmission is believed to be relatively low, but out of an abundance of caution, we have the patient being monitored in a special isolation unit at our campus. We anticipate that the patient will be monitored for at least 48 hours and can hopefully then be returned home and discharged from the hospital. We are contacting a small number of staff and patients who may have come in contact with the patient at one of our clinics. We're implementing a screening system in our electronic health records to identify patients at risk for this infection going forward. Again, I'd like to recognize the great collaboration and coordination and assistance we've had from all levels of this multi-layered response team, including the CDC, the State Department of Health, the Snohomish Health District, and our other local leaders. So with that, I would like to turn it over to Dr. Pillai, an official from the CDC, for his remarks. Thanks.
I want to thank and commend the State Health Department, local health district, the healthcare workers, and emergency medical service workers that have been working tirelessly, and you see the fruits of their labor. I'm glad that the individual that's currently in the care is doing well, and I think the strength of the public health system was really shown in the past 72 hours as the situation has evolved. As you heard, this is a novel, new viral infection, and we continue to learn more every day. As you heard, this is something that we consider to be of low risk to the public at large, but we want to be vigilant, and we are very appreciative of the opportunity to be here with you all to support the state, the local health department, the healthcare facilities as you continue your investigation and as you continue to care for this individual. With that, I'll stop and open the floor for questions. Thank you.
I'll take this question.
Patient lives alone and or was traveling alone, and that might be reassuring that some.
Yes, this individual.
Chris, why don't you come up
Okay.
to the microphone?
The question was, does this individual live alone? And the answer to that is yes, he does live alone. He was traveling alone socially, but surrounded by others, and so that is part of the work that's being done to identify who those others in close proximity to him that would need follow-up education and monitoring. That's in process.
What can you say about why he was traveling to central China?
He was visiting his original home and is a permanent resident here now. He's coming back home.
Yes.
So I know there wasn't a direct flight. Do you know where the connecting flight was coming to CPAC?
It's not confirmed yet, but we know it wasn't a direct flight from Wuhan to SeaTac.
Okay, so you don't know where the connecting flight?
We're not confirmed yet.
Okay, and it took, so he wasn't feeling symptoms when he landed here on the 15th, but is it possible that he could have exposed it to people on flights earlier than that?
Yeah, so we do know he was not symptomatic on the flight, but as was stated earlier, this is a new virus, so we don't know when you're truly infectious. Like some viruses, you can be infectious a couple days before you show symptoms. We don't know that yet, so this is part of learning a new virus. So, I mean, we've known about this for about a month and a half, so it's a great question. You'd make a great epidemiologist, but we just don't know those details yet.
And to follow up on that, it sounds like it.
If you can, Stephen, just talk about how the process is going to work to notify people on the plane and the like. Just tell them who's going to be doing what in that regard.
Right, so determining who was at risk of exposure is the first step. So is it 6 feet distance? Is it a flight? Is it when you're symptomatic? These are all details we're working out with CDC right now. So the Department of Global Migration and Quarantine will take care of the air flight here. Once he lands here, it's a state responsibility. So finding what his transport was from the airport to his home, talking and tracking down those folks who are at risk, and monitoring them for 14 days. We know it takes, once you're exposed, this we do know, it takes up to 14 days to develop symptoms. So we'll,
Yeah, are there certain areas specifically in Snohomish County? Because you've got people living there and they're reaching out to us.
yeah, so it's going to be CDC DGMQ for airport issues. It's going to be the state assisting Snohomish and their disease investigators that do this for a living. This is not the first time they've had to do something like this. And they will reach out to the patient and any deemed exposures in Snohomish County.
And then finally, there's some reports that Harborview Medical Center is handing out masks to people displaying symptoms. Is that?
That does not sound correct to me,
No,
nor is
okay.
it a recommendation from the state or
Okay.
CDC.
Can I add something to this too? In Snohomish County, we understand how people would be concerned about something that's new. This is human. This is probably healthy. I just want to say there's nowhere in Snohomish County that I would be reluctant to take my new granddaughter or my family members. This is a low risk. It appears to have a transmission vector that really should not prevent anyone from going anywhere in Snohomish County except maybe the isolation ward at the hospital. So we want people to continue to enjoy Snohomish County, and we think they will.
Following up to that question though about areas, can you tell us what clinic?
And transparency with the public. You see in real time the information we're sharing with the public. And I think that's important to say because unfortunately we've seen some cases where people have suppressed science in our federal government, and we want to stand arm in arm with the CDC to continue to make good scientific health decisions. We believe if these folks have the ability to do that, they will do that. That's extremely important to work in partnership with them. We look forward to that.
What should people be looking for in terms of, how do they know if they just have the common flu or if they have something, if they have the actual coronavirus?
Yeah, that's the trick to this, is because this novel coronavirus can look like the flu. It can look like a common cold. What's really in the case definition, which is a definition we use, you have to have exposure to the known site of transmission. So if you were to say, look, I was in the animal market in Wuhan, China a week ago, and now I have a runny nose and a bad cough, perfect. But just anyone who has cold and cough symptoms that has not traveled, at this point, it is not a good indication, nor we would consult with CDC, is this a person to test? And the answer would be no, because you don't have the epidemiologic risk factor. The other caveat is if you've been exposed to someone who has confirmed novel coronavirus.
Did this patient have a pre-existing condition that made them more susceptible to this, or were they perfectly healthy before this happened? And what symptoms did they show? Are you able to tell us that?
The symptoms were as described.
Thank you.
The symptoms in the individual affected were as described: fever and cough, and no known underlying medical conditions that would predispose to a bad outcome.
We're relieved to hear that he's in satisfactory condition. Can any of you tell us how he's doing in terms of his spirits? Is there any information you can provide us in that regard?
Yeah, I can tell you that he has been, he asked for a phone to call his family. He's resting comfortably and appears really clinically stable. obviously monitoring it very carefully because, as you've noticed, noted there have been people who have died from this, but he's doing well so far.
Are his parents in China by chance, or?
I don't know that.
Okay, thank you.
And you're confident it's safe to send him home in 48 hours or whatever time frame, or do you have one
I
yet?
think that remains to be seen. I mean, I think that as we learn more about his particular case and about this virus in general, that will be a call that we'll definitely make in partnership with the Department of Health and CDC.
Not decided yet.
Correct.
How are the airlines and the government relating to people who are traveling and the disruption in their plans and having to rebook? Is this expense coming from families, or is it compensation, or how is that happening?
I certainly do not know the answer to that question, but I do know when you're dealing with a virus with some uncertainty associated with it, these are clearly the right decisions for our communities and our families. That will be worked out, I hope, to everybody's benefit, but our commitment needs to be to the general public, and we're exercising that today. We will, I know, continue to share information as it becomes available. Thank you, and be safe, and wash your hands.